Hi, I'm Jess.
And I'm Andrew, and we're from Code Blue. Ellen McKeon Levine is a dedicated, compassionate radiology nurse whom we interviewed in order to learn more about her position and role as a registered nurse. A radiology nurse has an important role in the medical field because they use radiological technology to diagnose and manage diseases and conditions. A radiology nurse must have a high level of expertise in radiological science to properly assess and care for their patients.
Without them, we would not be able to correctly treat cancer patients who require a precise radiation treatment plan. Ellen has been a nurse for several years and shows us an obvious love and passion for her job. She loves working with people and taking care of her patients, which is something as future nurses we should all respect and strive to do ourselves. Through the interview process, we were able to see this passion firsthand while also learning about a field of nursing that many of us were previously unfamiliar with.
And here's the interview. Enjoy.
Do you mind telling us a little bit about yourself and what kind of nurse you are and whatnot?
My name is Ellen McKeon Levine. I have been a nurse since 1985, and currently I work as a nurse in interventional radiology at Brigham and Women's Hospital in Boston.
All right, and would you mind describing the main responsibilities of your position?
Well, I have been in interventional radiology since nurses came to interventional radiology. 15, 20 years ago, there were no nurses in interventional radiology. There were just technologists and physicians. And I don't know if I should be truthful, but I suppose I should be. The reason that nurses were brought into our department is that bad things started happening to patients. That in our department, patients would receive contrast, they would have painful procedures, and without a nurse in the department, there was no one who could deliver medications to keep the patient comfortable, that was certified to deliver medications to keep a patient comfortable. Or if somebody had a contrast reaction, you have to deliver immediate medications, you have to give aerosol medications, and you also have to give medications through an IV. And unfortunately, a technologist wasn't certified, and a doctor could give the doctor's order, but no one knew how to deliver the medications except for a nurse. And so nurses were brought down into my department about 15, 20 years ago. And our job now is to deliver pain medications to patients to keep them nice and comfortable for their procedures. And if anything bad happens, the nurse is the one who also knows how to administer all the medications to keep the patient safe and who to get in contact with if you need somebody else to be involved.
All right, great. And so what would you say is most satisfying about the job for you?
I knew that I wanted to be a nurse ever since I was a little kid, and I love my job. That's the one thing I can say, is that I absolutely love my job. Every single day I go to work and I meet a whole array of different people, and they have all different problems. And the patients, in spite of the fact that they have all these problems, are usually incredibly optimistic, and they're incredible people. They're everyday people just like you and me. They're people your age and people my age. And I love interacting with people and knowing that what I do helps them.
And what would you say is least satisfying, and why would that be?
Well, you'll learn soon enough that your job as a nurse is never enough hours in a day. Your day is never the length that you think it's going to be. So don't ever expect that your day, you're working an 8-hour shift, a 10-hour shift, or a 12-hour shift, and that's the length of your day. In nursing, you have to be flexible. You have to understand that humans are not perfect and that time sometimes becomes irrelevant. So it's great to be a flexible personality.
And how did you decide to get into the field of nursing?
So I was in the hospital when I was a little girl, and I ended up having to stay in the hospital for 6 weeks because I got sicker, not better, when I was in the hospital. And while I was in the hospital, I was in the intensive care unit. And my one take home from the hospital was that I had a mean nurse. So I came home from the hospital as a little girl, and I told my mother, when I grow up, I'm going to be a nurse. But I'm not going to be a mean nurse. I'm going to be a nice nurse. And I want that to be all of your take-homes today, because you're going to meet some rough and tough people, but don't let them be your role models. Make sure that you always take the high road, that you're always a nice person, because every day that you're not the patient is a good day for a nurse.
All right, and so kind of tell me about the training and education that you had, and do you think it's helped you, and if not, what has helped you?
But when I was young, there were nursing schools, and they were almost like trade schools for nurses. How people go to become a plumber, an electrician today, people became nurses, and it wasn't a college. I went to a 3-year nursing school. I went to a school called St. Vincent's School of Nursing in Worcester, and I received a diploma. You didn't even get a college degree in nursing. So I received a diploma, but thankfully my mother was very educated, and she had already had a master's, and she said, well, you can't end with a diploma, even though 95% of my friends were just all going to start work. My mother said to me, no, you still need to get a college degree. So I ended up going right after I graduated. I got a job in Boston, and I went to Boston College, and I received my college degree immediately after getting my diploma. So I had a 3-year RN and a degree from Boston College, but I gotta say my 3-year RN, right from the moment I was a freshman, this is what's different about college educations for nurses today, is immediately when I was a freshman, I started nursing school, and immediately Wednesday, Thursday, and Friday were clinical days. So every single Wednesday, Thursday, Friday, from when I was a freshman through, 3 years, whatever that counts as, we had clinical days. So we received a lot of clinical training through the nursing schools.
And that was definitely helpful.
Definitely helpful, but the theory is huge too. You also need to understand the science and the pathophys behind nursing. So I got to say, when I went to Boston College and I relearned all of the sciences and the chemistry and the physiology behind nursing, I appreciated that as well too.
Great. And so what recommendations do you have for someone who's kind of wanting to enter the field of nursing and progress in the field of nursing?
I say you guys are so lucky. When I became a nurse, way back when, some of your professors might appreciate this, nursing was not a valued profession. You know what? Nobody cared about caring. Caring? Who cared? Nobody cared about caring. And so when I entered nursing, it was looked down upon to be a nurse. And now I love to see all the educated, incredibly smart, talented, bright people that all of a sudden are realizing that, you know what? Your job is so much more than money. It's so much more than books and computers. You're going to be taking care of people. You're going to be taking care of humans. You can't make a mistake. Every single day, you have to realize, like, oh, if I make a mistake, somebody just doesn't lose $1,000. What you have is the most valued commodity in life. And all of a sudden, it's making me realize that, thankfully, smart, intelligent men and women are realizing that nursing is such a valued profession, and caring is the most important thing you can do.
Okay, great. And what advice do you have for being a successful student who's studying to become a nurse?
Do your homework. Do your homework, because it's all going to come back to you. And every single thing you learn in class today, you're going to need to take care of your patients tomorrow. And take notes. Take notes and keep your little cards, and never be afraid to ask questions. Even if you have and I know that you guys have talked about how nurses can eat their young. Never, ever be afraid to ask questions. And if you don't know something, never guess, always ask. You'll be the smartest person for that.
Sounds like good advice, Mom, Ellen. So what skills and personal qualities would you say are important for success in the nursing field?
Okay, the number one thing that I say is always remember that your patient is where you're going to get your most information from. I don't know, I can remember the days of doing like the chart reviews. No. the number one thing you do at the start of every single day, when you meet your patient, you say to them, how are you doing? How do you feel? Are you in pain? Is there anything that I can help you with? Make sure that never think that a chart will give you more information than your patient themselves. And you always should start your day by spending your first, hour or 45 minutes meeting all 5 of your patients and say, hi, I'm your nurse, introduce yourself and say, what can I do for you today? And go into all 5 of your patients. And then you have to learn how to triage. You have to learn, like, every single person is going to tell you something. And you have to learn to identify what is the most serious out of all the things I've heard today.
Mm-hmm. And what about like personal qualities, like yourself as an individual, like when it comes to nursing?
Always be flexible, always be open-minded, never be judgmental. You know what? You haven't walked a mile in other people's shoes, and you're going to meet all walks of life. And the bottom line is you need to be open-minded. You need to appreciate where everyone's come from. Like, if you can compare your nursing path to Maslow's hierarchy of needs, I know that now, all you nurses are super smart and you're all, want to work in an ICU. But no, you need to look at nursing like it's Maslow's hierarchy of needs. And the bottom foundation might be a really crummy job. My very first job was with the chronically ill. I worked at St. John of God for the chronically ill, where I worked with very old people who had multi-system organ failure. And that was my very first job. It wasn't glamorous, but I learned so much from that job that when I entered a big city hospital in Boston, I could walk rings around new grads who didn't have that experience. So never think that a job is beneath you. And I know that for whatever reason, people are getting programmed to think that some jobs are beneath them. Never think that any job is beneath you. Every single job has value, and then work yourself up to a position that you have in your mind. But if you don't have that bottom layer, don't think you can be an emergency room nurse and an ICU nurse without that bottom layer. And I don't understand why that's being encouraged. But
so what would you say a typical day at work is like for you?
So I work in interventional radiology, and we go in and we really have a multidisciplinary environment that I work in, and the nurses depend upon the doctors, who depend upon the technologists, and who depend upon the nurses' aides to all work together for a great day. So we go in and we have rounds, and all the doctors and the nurses, and we're a teaching hospital, so we have fellows and residents, we have student nurses. We all meet together and we talk about every single patient that we're going to have that day. And we try to figure out if there are glitches, if there are lab values that are off, if patients are going to need the anesthesiologist to do their case, that they won't be
able. Do you have a lot of patients that go in and out of your department, or how many on average?
Yes, we have like 30 patients a day.
Okay.
And it's some of our patients are outpatients. Some of our patients are the sickest patients in the hospital from the ICU. Some of our patients come from the emergency department. Some come from Florida. Some come from Dana-Farber. We're affiliated with Dana-Farber, so we do all the cancer care ports placements. So we have a whole array of patients. So we have to figure out how to best care for a huge variety of patients every single day.
Got it. And would you say that your primary group of patients are kind of like cancer patients and whatnot, or would you say you kind of get like a variety of different types?
Yeah, no, a lot. We always say that the bread and butter of our hospital is the Dana-Farber patients, because we place all the central lines, all the ports, and the Hickman catheters, and the PICCs for Dana-Farber. So that's probably 40% of our patients. But then we also put lines and drains in gallbladders and kidneys and livers. Then all the nurses have to be able to care for sick and not sick patients. And then you get your assignment, and our job primarily is to give IV conscious sedation. That our procedures are very uncomfortable for patients, so we all have gone to the Harvard School of Anesthesia, and we're all certified in delivering IV conscious sedation. So we can give 2 medications, fentanyl and Versed, that put our patients into a gentle sleep. But in order to be able to be IV conscious sedation, you have to be basic life support and advanced cardiac life support certified.
Got it. And so you would say, how many patients would you say you do in a day?
Me personally,
Yeah.
anywhere from 4 to 7.
Okay, great. And so what are the hours that you work?
I work 9:30 to 8.
So what would you say the opportunities for promotion and advancement are like in your field?
You know what? I think that that's the beauty of nursing, that if you want to advance yourself in your field, you can.
Mm-hmm.
It definitely is another type of, the beauty of nursing is that you can work as many or as few hours as you like. It's a
So I
very-
know you personally are currently in the final leg of studying to be a nurse practitioner.
Yes, I
So
am.
that's kind of one of the ways that you
Exactly.
personally have been advancing your degree.
Uh-huh.
What would you say the entry level salary is for a nurse?
Gosh, you know what? I'm not 100% sure, but I think you can have a nice life. I think it's at least 75,000.
So my final question is, what professional organizations would you recommend for practicing RNs to consider joining?
Well, I'm a little biased. I'm a member of the Mass Nurses Association.
It has been a pleasure speaking with you. Thank you so much for taking the time to sit down with our Nursing 100 class. I hope one day.
You've got so far to go. You're gonna, and boys. I hear there's a few boys.
Once again, Ellen McKeown-Levine, interventional radiology nurse at Brigham and Women's, Boston.
We hope you enjoyed the interview.
We would like to thank Ellen McKeon-Levine for her time.
The most fulfilling part of her job was getting to know a variety of people and witnessing how positive her patients are despite their illnesses. However, there is not always enough time in her day to be with all of her patients.
A poor experience she had with a nurse as a child left an impact on Mrs. McKeon-Levine and motivated her to attend nursing school, eventually earning her degree at Boston College.
Reflecting on her many years in the nursing field, she advises prospective future nurses to be caring and invested in their patients, as well as being flexible and dedicated to their studies. In her opinion, qualities that good nurses possess are humility, thoroughness, open-mindedness, and the ability to be non-judgmental and accepting.
Mrs. McKeon-Levine begins each workday by discussing her assigned patients, and the rest of the day she is primarily placing chemotherapy lines for patients with cancer.
In the field of nursing, there is always opportunity for advancement and continuing education. Ms. McKeon-Levine highly recommends taking advantage of these opportunities. She currently is in the process of becoming a nurse practitioner herself.
Interviewing such a knowledgeable and experienced nurse who has gone through everything we as nursing students will soon face gave us reassurance that as long as we work hard and are dedicated to our studies, we will succeed. Ellen McKeon-Levine is someone we as future nurses should strive to be like. She is smart, kind, dedicated, and most of all puts the well-being of her patients above all else.
Thanks everyone. Code Blue out.